the brain operates in virtual reality anyway. It has its own universe of neuronal firings. Once it knows that's me, it immediately utilizes that information for its benefit. 99% of what the brain does is just take care of itself. And so when we try to put ourselves in charge of improving brain function, that often doesn't go very well. But if we just show the brain its dance, now we're putting the brain in front. The brain is in charge of its own recovery. We're just furnishing the information. By and large, this is a very self-correcting process.
What kind of neurofeedback were you using, and what kinds of things were you seeing that led to like the necessity of a new technology? What was the point of this new technology?
Well, we didn't have the right words for it at the time, but we have the right words for it now. And what we call our method is endogenous neuromodulation, is that we just get to watch the EEG, because the EEG is the information, does contain the information that the brain needs in order to improve its own function. That is the essence of the story. So
when you say watch the EEG, if I'm in neurofeedback, I've got the electrodes on my head, am I literally watching the EEG as it goes by? Is it the person, or is it the clinicians watching it? We're both watching it? What is that picture?
Well, mainly the client.
Or am I going ahead?
Right. The client has to watch it. The clinician, just needs to see that it's a decent signal, good quality signal, and so forth, and reassure themselves that all is well. But then the details escape the clinician. It's another world. When the brain engages with its own signal, it is in its own world, right? It's operating in first of all, the brain operates in virtual reality anyway, right? It has its own universe of neuronal firings, which it uses to make up what we experience. But in its own little universe, it's just neuronal firings, right? And whatever sets the context for that. And so now we show it the activity, the neuronal firings, and the brain, it's a recognition. The brain, it says, this is me. Not only that, once it knows that's me, it immediately utilizes that information for its benefit. And that is, of course, the way the brain is organized. You can think about that in terms of, our motor responses. The way we learn a motor skill is by the brain watching itself perform the skill, whether it be shooting pool, shooting baskets, playing the violin, learning how to play the piano, all of that. The skill gets built by the brain observing itself performing the skill. And so now when we show, well, what is the brain's essential activity? It is taking care of itself. Everything else is detail, right? 95 to 99% of what the brain does is just take care of itself. You can think of it as just an aircraft carrier, there may be a handful of pilots on the board, but there are 4,000 people on board just keeping the ship going, right? And so the brain is like that. Most of its activity is just keeping the ship going. And now endogenous neuromodulation is that ongoing activity. Nobody's doing anything to it. Now the problem is that neurofeedback entered into our pathological medical world where we insist on being in charge of what happens, right? The therapist always needs to be in charge. That is obligation, right? And on the MD, the psychotherapist, everything. But here, you see, we're encountering this complex of mysteries. We don't really know the rules. And so when we try to put ourselves in charge of improving brain function, that often doesn't go very well. But if we just show the brain its dance, now we're putting the brain in front, right? The brain is in charge of its own recovery. We're just furnishing the information. Now things can still go wrong, but then that just means, okay, we're dealing with very complicated brains which are highly dysregulated, and so we need to be more delicate in choosing what information to show the brain. But by and large, this is a very self-correcting process. The brain operates in its own wisdom. And its wisdom is, in fact, profound. The fact that the brain recognizes this activity as self is already staggering, right? And that's what makes the whole thing work. So we can think of endogenous neuromodulation in two ways. One is, of course, that is the native activity within the brain. But we use the term endogenous neuromodulation as the process, right? Because we're putting that in a feedback loop, and now the brain is witness to its own activity and gets to alter its native ongoing activity in very subtle ways. And this happens at a level of such subtlety that it could not be outsourced to someone else. We really have to let the brain do this. This is humbling, right? Like physics. You just have to stand back and say, okay, we're at the level of subtlety where we can't, as external observers, decide whether this is better, going this way is better than going that way. It's a little bit like, think of you're driving down the freeway and your hands on the steering wheel, but the fact of the matter is, you're not worrying about the steering wheel. Your brain's got the steering wheel, right? It's taking care of the steering wheel. You've got better things to think about than staying in the lane. So your brain's taking care of that. But the tiny little adjustments in the steering wheel that keep happening are really at a much more subtle level. It's not like the car's being steered wrong, right? It happens at a subtle level that we cannot begin to supervise, right? And the net outcome is that your car is staying in the lane pretty well. But the process is not something that we can supervise to advantage. And that likewise, when the brain is dealing with its own internal mechanisms, as outside observers, we don't have a chance. So let the brain do what it's good at, and we just empower it, right? So that this is the essential revolution that traces all the way back to the practitioner that we learned from, namely, let the brain do it. Now she didn't have that, she very much thought that I'm in charge here, in her own mind. But the person was sitting there in the other room, not being attended to, right? No. The brain was doing it, and but that's the essential dichotomy in the neurofeedback field. We got so many people who said, "Okay, I'm in charge of this process," and they said, "Nah." So endogenous neuromodulation is actually happening with all those people also, right? Because the brain lunges on this information in ways they don't even appreciate, but they can still live under the illusion that they're in charge.
Got it. So what you said there was so fascinating. There's so many different pieces of it that I could go into, but just to reflect back what I'm hearing to make sure that I understand correctly. So when somebody is watching their live EEG during a neurofeedback session in this regard, what's happening in your mind is that the brain is able to auto-regulate more or less, right? It's picking up on its own signal like a mirror in close to real time, where it's able to go, oh, that's me. This is something that I'm doing. Oh, I don't like that. I have a hair that I didn't shave correctly on my cheek, and so I'm going to go and shave that right now. I'm going to go clear that up. I'm going to correct myself to be more in alignment how I wish I actually was. Is that kind of what I'm hearing?
Yes, but what I need to say is autoregulation is the brain's life, right? Nobody else is right? It's got to take care of itself. Nobody else is doing it. Okay. So we're just refining the process, allowing the brain to refine the process of autoregulation by giving it this additional, very potent feedback path. And now the challenge is, in the normal brain, this is no big deal. Anybody can come and that doesn't have a lot of psychopathologies and so forth, have a great time, and maybe they get a slightly higher IQ out of it, and maybe they sleep better, a little better out of it. But there's not going to be very much drama, right? But when we're dealing with cases where the brain is more dysregulated, where more with severe psychopathologies, then there can be drama, and that's why the clinician needs to be absolutely in the loop.
Yeah, well, that was something you said earlier. You said, like, depending on the severity of, was it the trauma or the dysregulation that's going on, like you might not want to show the brain all of the parts of itself immediately. And again, you talked about the brain being in virtual reality. It just strikes me very much how that's even like a very informed like trauma response within like therapy, right? There's a sense of like, hey, you might want to like not look at all of the dark parts of yourself immediately and the pains that you've gone through because you might not be able to handle all of that right away. And so you kind of want to take things in chunks. Is that a similar kind of thought process with the more dysregulated people?
We need to make a distinction here. In this process, the traumas of the person are not at issue. That is, the substance, the historical facts are not at issue. What is at issue is the physiological response to the trauma. And this is now the huge conundrum in mental health, right? That we are increasingly dealing with a traumatized population. We've been taken out of our natural environment as a species, and childhood trauma is now commonplace. It is the biggest looming issue in mental health, and it started to be recognized, but it's still under-recognized. And the thing is, a lot of this trauma is actually pre-verbal. And how does the body deal with that? Well, the trauma response can only be physiologically encoded because the memory function, recallable memory, that isn't there yet. So it's not available for recall. But the physiology remembers, right? The physiology has learned. And of course, the trauma response is a case of one-shot learning. There only needs to be one, to alert the brain for the rest of life and alter its set point for the rest of life. And that makes it so problematic, and it also makes it hard to deal with because it's a natural response. Why should the brain give it up, right? The trauma was real after all. World is not safe. Life is not safe. I need to protect myself, right? Why should that wisdom that acquired early be given up? Why should the brain relinquish it? So this is a very tough nut. But that is the essential problem that we face, the most difficult problem we face in all of our work. The person who are profoundly traumatized early in their life, and they are not happy people. They're carrying a huge burden, and the world, of course, is not kind to them, and they're not kind to the world. So it goes both ways. This is a terrible affliction, and that is our core challenge. And that's when our life gets really dicey. Guiding those nervous systems to better function it calls upon our entire skill set.
When you see somebody who's gone through a tremendous amount of trauma at an early young age, and they're there because on some level they're showing up because they want to get better, right? But on some level their nervous system does not feel safe. So how do you approach somebody like that and guide them safely through that process?
Actually, the relationship of the trauma-informed therapist and the client is hugely important here. There needs to be this relationship of trust. But what there doesn't have to be is a discussion of the traumas. We're just training the brain here, right? To a state where it can live tolerably, right? In better control, where you're not in the grip of the trauma response. Is the trauma response at some level still there? Of course. This is like a scar tissue or something. This is so deep. I don't think we ever, we don't erase it. We're not an eraser here. But we can shape that person's experience through the training to where the person then goes forward with more of a sense of safety, of not living under constant threat, and so forth, right? We can change the physiological set points. And all of that can happen without discussing the traumas. We don't need to talk about the traumas. We don't need to talk about what happens. We don't have to argue whether your trauma is real or not. The physiology is dysregulated. That tells us you're living in the trauma response. We need no further information. We don't need the history. We don't need the recordings. We don't need the reports. The physiology is screaming at us that this person is living in a trauma response. And this is not quick, but then there is the other part. There can also be with traumas that are remembered, the psychological aspect, right? And for that you do a different kind of program. It's still endogenous neuromodulation, but now we're in a different realm. Now we're in the realm of alpha and theta. It takes us to deeper states where our critical verbal faculties that tell us we'll never amount to anything, and have the adverse words of our parents, reverberating in our brain. No, all that goes silent, and we get to experience our core self, which is nonverbal. It gets to reveal itself through imagery. And so in this sort of quasi-dreamlike world, you may undertake a journey that leaves you afterwards profoundly altered, and you may not know why. But it was a healing journey in a very profound sense. And we have to turn it over to the brain. In this case, to the self that inhabits that brain, which when given space, when given the floor, when given the Klieg lights, will reveal itself, and that is always a wholesome experience, right? The encounter with the core self is always positive, is always wholesome, and that is then the ultimate rescue remedy for the deeply traumatized self, and that so there is the physiological aspect, and then there is the psychological aspect, but both are allowed to be the brain's journey. We're not micromanaging. We're not, subjecting the brain to a close order drill here of yays and nays and left versus right and so forth. No, we turn the journey. We liberate the brain to undertake its own journey.